health and well-being, the connection between gum disease and other diseases. Dr. Greg Wych is also available to answer any of your dental questions online at WISTV.com. He's been doing that. But, Doctor, I want to talk to you first about the fact that I was blown away when you said 75% of people have some form of gum disease.
Yeah, it's amazing. Most people have no idea, but 75% of Americans have some sort of gum disease. And the problem is that, gum disease doesn't bother you, but, your gums bleed, and a lot of people think that's normal, but, if you brushed your hair and your hair was bleeding, that obviously wouldn't be normal. And that inflammation takes bacteria that's in your mouth, and there's 300 different kinds of bacteria in your mouth, and it takes it to areas that could be weakened. And it could, they've shown bacteria in diseased aortas. They've shown bacteria in people with plaques that build up from cholesterol. It's an incredible problem.
In fact, I see some of the video that I pulled today shows some of the plaque well, that's the picture of the mouth there, but we see some of the things that happen with the heart. So there is a connection, you would say, definitely between what happens in our mouth and what is happening in the rest of our body.
Oh, yeah.
So how do we prevent, like especially if that we're in that 75%, what do we need to do to prevent ourselves from having gum disease and it leading to other problems?
Well, certainly proper oral home care is always the first thing. Going to the dentist regularly every 6 months. Most people actually need their teeth cleaned every 3 months. They don't realize that. If you have any kind of symptoms of heart problems, talk to your cardiologist, and then he should send you to your dentist. And your dentist may want to send you to a periodontist, who's a specialist with gum problems.
Before we wrap up, touch on pregnant women and the significance of their gums.
A lot of pregnant women have inflammation in their gums because of the hormonal changes. If they let it go, it can develop into a gum problem called pregnancy gingivitis. Women with pregnancy gingivitis in their second trimester are 4.5 to 7 times at greater risk for preterm delivery, which is huge.
That's so significant. That's great information. If you have any question about that or anything related to your teeth, Dr. Wych is online at WISTV.com/4 p.m. Go right now. He'll be here until 4:30. Doctor, thank you so much.
Thank you.
Let's check in with Tim in the weather.